I'm a superintendent of school systems. I have about 400 employees. You know, when you're running a school system, you want to build relationships with your teachers and your school staff. And so little bitty things like not being able to see their name badges was, you know, beginning to impact how, you know, I wanted to do my job and build those relationships. Several years ago, I was diagnosed with Fuchs disease with my eyes, and my eyes were steadily getting worse. And I always had eye doctors who had told me, well, eventually you're going to need a cornea transplant. Gotten to the point where things were becoming even more difficult, even with glasses.
Little day-to-day things like going to restaurants, being able to read menus and signs and things like that. Just little things in your daily routine that sometimes you take for granted became very limited for him. It made his golf game more frustrating. He couldn't see the ball anymore.
He was sent by his optometrist, who noticed that he had Fuchs dystrophy and cataracts, and these combination of factors were lowering his vision. So Fuchs dystrophy is a disorder in which you have little bumps start to grow on the back of the cornea. Now, the cornea's got 5 layers, and the innermost layer is a layer of pump cells, and the purpose of these cells is to keep your cornea thin and clear. If something goes wrong with these pump cells, the cornea swells up with fluid. It's kind of like looking through a dirty fishbowl with Vaseline smeared on the side. What we decided to do for him was a combination procedure in each eye to remove his cataract and to treat his Fuchs dystrophy with a procedure called DMEK. And while we were removing the cataract, we thought to give him a lens that would try to give him the best possible vision for his specific visual needs. So this combination procedure, the cataract extraction with the special Symphony lens, plus fixing the Fuchs dystrophy with the DMEK, we're able to perform just right here in the office in our procedural suite here. The total length of the procedure was just about 15 minutes per eye. So we do one eye at a time, one eye and then the other eye a couple weeks later, and he has done extremely well, and we're just so glad to see him do so well.
I don't need glasses anymore. I can read my phone. I can read my employees' names. So it's really made a dramatic improvement in my day-to-day life. I could see at the bottom where it said the 2020 line. I said, oh, this is the 2020 line. So it's been several months of gradual improvement.
I'm letting him drive again. I'm more at ease in the passenger seat. He can function now at work and at home, rarely having to wear glasses at all. I'm excited that he's going to get to go to the golf course and to be able to see his golf ball again, because he comes home very frustrated when that happens. Dr. Jack Parker was wonderful. He just made us feel so at ease. Was able to answer every question and concern that we had, and just very available throughout the procedure, before and after. I had never had a doctor that I was able to access 7 days a week, and I could. He is truly amazing.
There's no doubt it's a game changer.